got cut. That package wasn't used, so that funding got cut, and there is a significant need for it. It was just there was no availability.
So that was the same as Cara. So Cara had funding. Yeah,
Oh, that's fine.
Cara had funding. She didn't use the funding because there was no specialist here for her to be able to use it. So that funding in the 12 months got cut.
And there is heaps like it.
Do you know the NDIS bill on that? The NDIS bill for the government is like 12 times what the entire general practice costing is. So what they fund for NDIS, I think it's like 144 billion, and general practice costs 13 billion across a 12-month period. Because the services we could provide for them.
You have more feet on the ground.
Yeah, oh my God. Like you'd have more general GPs in clinics because the funding's there. Whereas at the minute, they're going urban, they're going into hospitals because the funding is better in the hospitals than it is in general practice, which you lose appointments, you lose mental health availability. It's, again.
And then it also falls back on us. Like you do your referral letters.
Yeah.
Go, you need to do this, and this. Oh, sorry, we've come back to see you because we can't get in for 3 years. What do I do now? And then it's pressure on you as a clinician to go try and problem solve it.
And it's not only access to services, it then becomes mental health problems, and then becomes urgent. It then
pressure on
And then they'll put their hands up and go, I'm out.
Yeah,
I'm done.
Exactly.
I'm gone city.
I can't handle the pressure. Too much strain. I know through COVID a lot of nurses and that one was like,
it's too much.
Catch up. Why am I doing this?
Especially when your choices get taken away from you as well. Like we had plenty of nurses that said, like whether or not you agreed with the vaccine, the choice of being vaccinated was taken away from people and forced upon them. And they were like, well, my independence is being taken away from me. I'm not doing this job anymore. On top of all of the other Sorry, shit does. No swearing.
We stay at Boston Bay Family Health with practice manager Sarah and nurse practitioner Holly. Guys, can you tell me who you are and what you do?
Sure. I'm Sally. I'm practice manager of Boston Bay Family Health Practice and co-owner with Dr. Bascom. We've been open for 17 years now here in Port Lincoln, and manage all the day-to-day operations of the business.
I'm Holly. I'm a nurse practitioner. I have been here in the clinic for I think coming up 15 years now. I see patients day in, day out, work with Chris, work with the team here. From kids to elderly, anything in between.
And what is it something that you love about this region?
I love that I've given my kids an upbringing that I had. So being able to go to the farm, being able to go to the beach. I think we've got the best of both worlds, being so close to the sea, but also having agriculture, animals. It's such a beautiful spot to raise kids.
Yeah, I agree. The balance, the lifestyle with the kids, being able to work Monday to Friday, but still have your weekends, still being able to finish at a decent time and enjoy your daylight savings with the kids. You can go down the beach, play sport. We can immerse ourselves with the coast, up country playing sport. We love it. Yeah.
And something that might frustrate you about the region?
I hate that the flights are so expensive. We're avid football AFL followers, so we would go to the footy every couple of weeks if we could. But flights for a family of 6 is well over $2,000. It's just unable to afford to do that. But as well, that then makes it unaffordable to go to medical appointments all the time, see family and friends that don't live in this region. So it's as much as this area is so beautiful, it's also super isolated, which is very difficult.
Super remote.
Yeah.
So denied access.
Yeah. I suppose being here, and we get a lot of patients from up the coast and whatnot. So it's a long way for them to have to come to us even to have healthcare here, let alone then having to turn around and say, oh, we've got to send you to Adelaide or we've got to send you further on because we cannot provide services here. We try our very best, but there are certain things we can't do. So that's, it's heartbreaking for us having to then drop that bomb and go, oh, by the way, can we try and work out how to fund this, or you need to go, there's no other options.
And quite often people don't have the funds to do that.
They know, and sometimes it's at the drop of a hat too. You've got to try and make the money work. Yes, you've got PATs, but that doesn't help right up front when you've got no prep. Yeah. So that's really a bit of a struggle.
What do you wish someone in Parliament understood about this region?
That even though it's a 30-minute flight, we are very remote. And it's not just Port Lincoln, it is this whole region up to Ceduna, even up to the border. We've got all these people coming down, we're isolated.
So you feel lack of services even on the coast, on the west coast, is flooding here?
Oh,
yeah. And,
yeah.
Snowballing, the effects of that as well. What about you?
I think I'd like them to know that we matter as well. It's super
Yeah.
frustrating when you see everything's just being urbanised and their focus is all on city. You've got country towns that are going, their housing is available. You just have to go a little bit further out. But if services were available out here, maybe it would be more attractive for people to live, businesses going out or selling up because there's no services available. So they are moving to Adelaide in these urban areas. But if the focus and funding was given to these regions, we could make them thrive again.
So medically, just going to kick that off, what are some handbrakes for you guys that you find?
Where do we start?
For your time today, ladies. It's always a pleasure.
Medicare in general, the funding is not enough in regional areas. They're working towards it. We are trying our best to make bulk billing work. I can't tell you that it's going to work. I would love to bulk bill every single patient that walks in. Nurse practitioners don't get an incentive, so we have to charge for Holly's time, which is super frustrating when she can do exactly the same as a GP, but we have to bill for it because they don't give her a bulk billing incentive. So the Medicare rates, they do taper them higher for the more remote you are. It's just not tapered enough. The Medicare incentive and the Medicare rebate is not enough to cover patient care and how we provide it.
And the demand, there is such a demand.
Yeah.
So in your case, Holly, if you have to charge for your services, like you say, you can't bulk bill, do people get put off by seeing you and you're kind of left in limbo going, I'm available, I can give these services, but people do not want?
Yeah, and it's kind of, I suppose...
Or cannot pay for the service.
Yeah, and I mean, we're not that...
I think unfortunately we do have to use Holly as we could fill her books easily if we could bulk bill for her, but people do use Holly as a last resort on the day because she's the one with the open availability to see emergency patients who then are happy to pay because they need to be seen today rather than wait in ED for sort of 4, 5, 6 hours. So she is used as the backup, which she shouldn't be. She should be the one that gets to be, she should be filled first because she's that brilliant. It just makes it a little bit frustrating when, the difference between Holly bulk billing, which she might get $25 back as a rebate, compared to a doctor who bulk bills might get $80 back as a rebate. So there's a vast contrast for a service that is just as valuable, if not sometimes more valuable, with the amount of continuity of care she can provide.
And I think sometimes with the billing numbers as well, someone comes in with a laceration, for example, and all the doctors are full, and it would be a quick suture, there's no billing item numbers for me to be able to do that. So there's, unless they're happy to pay privately, they then have to go and sit in ED and wait, which is triage is like a category 5, so it's not important, and they could be there all afternoon.
Yeah.
And do our current ED bed situation here is not enough for this region?
So Lincoln was approved for, and this is probably one of our next frustrations, Lincoln was approved for a new emergency department. It got put off for, we don't know why, it's been told another 3 years now. We probably would be able to see quite a few more patients, but we've been told that it's not happening anytime soon. It's not a priority right now, which, especially given that everybody comes from us from Ceduna to Whyalla, they all come down to this region for most of their, babies and that type of thing have to come here with the next big regional hospital. ED is so far behind, especially when Chris goes to Adelaide and does a training day and the facilities that they have there sitting up in a level 2 only used for training. It's not used for any patient care, 10 times better than the funding that we have here for our emergency department. Millions and millions of dollars worth of equipment that they the students and the med students practice on, and we can't even get it in real life to use on real patients. It's ludicrous.
Do you feel like red tape is playing a role in holding you back from providing care?
I wouldn't say I think it's just funding. Like if we had appropriate funding, we could do so much more with the resources we have. And we could have so many more resources.
Well, we're a growing population. We're only getting bigger.
Yeah.
Housing and affordability, everything's just expanding. But we're not getting anything.
Yeah. And this region gives so much in taxable dollars to the government with farmers, fishermen, doctors, and we don't get that back. Like a percentage of that should come back into this region so that we can improve our services and our resources. It just doesn't seem to get spent here. It's just all urbanised. Yeah, I think that comes back to flights too. So you bring a GP out to visit the region and they see how much the flights cost. And all of a sudden it's like, well, to go back to Adelaide for a weekend is $500 plus accommodation. If not, that's just for them, when they start adding their partner and their kids, it can be $3,000-$4,000 just on flights to get back to Melbourne or to wherever their family are. So we've seen a lot of doctors come and go because they've had families or had children and they want to be closer to family because the isolation that this region gives, basically just because of flights. If they could jump on a plane, get back to Adelaide or Melbourne for $200, changes the ball game pretty quickly. Again, funding what we can then pay doctors if Medicare increase their direct wage increases as well. So it's
flow on.
I think it really all just hinges on funding and flights, really.
So many people have brought up flights and affordability.
When they used to have the I think it was like $119 or $149 flight, they were fantastic. I do think they did it wrong when they did the within 24 hours you can get it for $148. I think that they should up it at the end. So people who are organised and can plan trips, they can do it a lot better, especially, for medical appointments. I know I'm going to have to go to Adelaide every month for the next 6 months. Well, I can book them out now. For Sally, she flies in and out every week. Dr. Sally, she flies in and out every week. So she could book her flights 12 months in advance at a much cheaper rate. Whereas if you are last minute Sally, then you're going to have to pay for it, which is fine. But I think they did it back to front when they did it, and now they don't have it. So.
And I think the habit too, in terms of specialist services that are coming over, most of them fly over the morning of and then fly back that night. And so this has really been a struggle with theatre lists and things like that as well, because flights are getting cancelled and they're, then that's a whole list. That's another, months while we're waiting for them to be rescheduled.
So they don't come back for another month and it's a month behind.
And then that's another
month.
Trying to tee it up with the anaesthetist. And then if they're from Ceduna and up the coast and that's probably already outlaid money to come down and have that time for those appointments that then now has to be rescheduled and they don't get reimbursed any of that.
What about aged care? Are you finding any stop dates there?
Yep. The ageing population is significantly impacting this community in that there is not enough beds anywhere for respite services, and so we're seeing a lot of there's funding and package changes and there's lots of intricacies with it, but a lot of people are finding they're coming in at crisis point now and then utilising the ED because we're having multiple falls at home or sepsis and things like that because there is just not enough support for the high care needs and the increased demands as they're getting older. And there's a lot of people that obviously don't want to go into homes and respite, but families that want that option that live locally in Port Lincoln might have to then send their elderly granddad or father or mum up to Ceduna or to Elliston or to to Cummins to these multi-purpose sites because there's nothing locally.
And they've paid all their taxes, lived every their whole life here, and to have their final years in a foreign environment is devastating.
And then isolated from their family too. It's an hour and a half to go and visit rather than it being a 5-minute drop in on the way home from school, that type of thing.
It's heartbreaking. And not only that, trying to uphold their dignity and give them that quality of life to be able to stay in their own homes. as much as we want to do it, it's that balance of what's safe and what's not safe. And so then we get to this crisis point where we're finding, you know, really unwell people because they don't want to go in, so they don't call. Yeah, so that's really sad too.
What about mental health?
We have a lot of really good mental health resources here. I find it really difficult in here with adolescent mental health. I think if you can afford to pay privately, it's okay, but in that neurodivergent space where we're getting a lot of kids coming through with new diagnosis of ADHD and those sorts of things, a lot of them need psychological support, and there's just nothing here for them. So it's an extensive wait list. Most families are coming in crisis wanting things fixed then and there, and it's a real struggle.
And it's a process.
It is a process. It's not a quick thing. You know, wait list for paediatricians, wait list for diagnosis. You know, if you can afford to pay thousands of dollars to go and visit Adelaide and sit there for 3-4 hours for a diagnosis, then no worries. But if you are the average family, you have to just sit and wait. And that's really, really hard.
I think again, funding has been cut for mental health.
Yeah.
They've tried to package it up nicely and say that we're offering this better access for mental health, but they've taken the item numbers away from the doctors. So we've lost funding and valuable dollars for the clinic, and then been told to still provide the same services for less money, which makes it difficult for everybody else trying to access services. So now we've kind of had to go back to offering 15-minute medicine when we would love to spend 20, 30 minutes giving mental health counselling. The doctors just can't seem to do that anymore because it's unaffordable for us to continue practicing that way, simply because they've cut the item number where the doctor can provide a mental health consult. We can do a mental health care plan where we then send them out. We can't do a mental health consult anymore, which is crazy. Like, who cuts funding to mental health? But they have increased it in central urban areas. So again, everything's just being centralised and urbanised rather than giving, extra resources and funding to regional areas.
That's astounding.
Yeah.
But,
And it was just snuck in under, we're taking this number away, but we're giving you a higher bulk billing incentive, which, there was no consultation. Well, I'm sure there was big consultation, but not in regional areas.
No.
Yeah.
The flow-on effect in regional areas and the decisions made in the city are two completely.
Yeah.
Yeah.
Because they have a mental health provider or a social worker on every other corner, which probably don't have wait times. We here have wait times for 2 years sometimes. It's like, I've had to take my son with ADHD to Adelaide to get seen. There's nowhere here that we can have him seen. So it just makes it really frustrating to see all the resources going to an urban area